Good afternoon, everybody who's joining us. I'm going to give us just a couple of seconds. It looks like the attendees tab is being populated. We want to give everybody an opportunity to settle in. And then we'll turn to today's agenda. Great. Well, let's get started. Before the official kickoff, I just want to welcome everybody, and I want to review a couple of logistics items. So participants will be muted during presentations, but we are saving time at the end for Q&A. You can use the raise hand icon on your Zoom toolbar, and of course utilize the Q&A feature to submit your comments and questions. If you're joining us by phone, that key is *9, and that will put you in the queue to be unmuted for a comment or question. We have closed captioning and ASL available. You should see our wonderful ASL interpreter, Pamela, on your screen, and you can enable closed captioning by selecting the closed captioning icon on your Zoom toolbar. Presentations and the recording will be archived. You can visit the CDA's YouTube channel or the Hubs and Spokes Network webpage to access both past and shortly this recording and presentation. And at this time, I will pass it over to Connie.
Thanks, Maria. Good afternoon, everyone, and thank you for joining our third of 4 regional town halls for the Hubs and Spokes for Aging and Disability proposal discussion. So we have stakeholder engagement opportunities that we've had planned over the last 6 months. Today's the third of 4 regional town halls. On the screen, you'll see that there is also, we have the leadership webinars. We have key stakeholder group meetings that we've been attending, and we have an online feedback survey that's available as well, and also written recommendation on regarding any of the content that is discussed. We welcome that by email. And we're also looking at conducting a results briefing in December that will collate everything that we've heard at all the town halls and webinars, and we've gotten as feedback so that we can have a results briefing to take a look at, are there themes and what the recommendations may possibly be. So where you can find a lot of this information is on our CDA webpage. Here you'll see that you can find, there's a link directly from our homepage. Just look for the Hubs and Spokes Initiative link under highlights. Next slide. We encourage all the feedback to be submitted by October 15th. That'll give us some time to collate all the feedback and organize it so that we're able to present it in December for further discussion. CDA and CCOA, again, we'll be hosting that results and recommendation briefing. Mid-December is what we're looking at. And what this all means is that everything's, TBD. What these recommendations and all the feedback we've gotten could include, state bills, budgets, any local actions to develop and advance any additional recommendations. So we're excited to see what these results and findings will lead us. And we'll be partnering with Sacramento State University that will be helping us collate all of the information that has come in. What you'll see here, we've got a quick poll. We just want to see who's joining us today. So if you've got a quick second, if you can tell us a little bit about yourself, we'll give you just a little bit time to fill out that poll. Next slide, please. While you guys are filling out the poll, we've got a packed agenda. So today's agenda, we're going to be opening up with discussing the opportunity for California to build back better. We'll go over the vision of the Hubs and Spokes for Aging and Disability in every community. We'll be listening to a couple local perspectives, and then we really want to make sure that we have time to engage in public discussion with everybody that's attending. So now I will toss it to Building Back Better, and I'll lead it to Sedalia Sanders.
Thank you so very much. I'm so happy to be a part of this. As a member of the California Commission on Aging, I would like to give you a little bit of a background of myself. Sedalia Sanders, undergrad work was in majors in 2, chemistry and chemistry and math. Post-grad work was business administration, emphasis in international finance. So I was a mayor of the city of El Centro 5 terms and member of the California League of Cities, president in 1995-96. Currently, I am now retired. I'm married and a mother of 2 and a grandmother of 6. So again, it is my pleasure to be with you. So next slide. Well, we see that Imperial County is not as diverse as some of the others. 25% of our population is over 60. Is under 60. 60 will be our next generation. 88% of our, well, and you know what? 88% of our Americans precede assistance living with a loved one. Other adults contribute to work, income, and family care. But I want to go back a little bit and just add some context to all of this. I think over the last 5 years with previous administration, and particularly with COVID, we've seen some age-old biases percolate and rise their heads again. One was, how do we deal with social justice? How do we deal with race, ethnicity, and gender? How do we deal with socioeconomic status? And more importantly, how do we deal with immigrants? So in those categories, I think Imperial County is most unique. We're unique because we are 1 mile from the Mexico border, 60 miles from the Arizona border, and 120 miles from San Diego, 80 miles from Riverside County. So we are below sea level and we are in the desert. So with that, let's move the slides forward. Thank you. You will note that what we try to do here in Imperial County with our AAA is expand our capacity. People say, how do you go about expanding your capacity? We've expanded capacity so that we can, in fact, build our relationships and coalitions with partnerships and other entities. In particular, County of Imperial, City of El Centro, and local foundations. This has brought us to a new level of support and how we are able to deliver so much to our people in Imperial County. Now you will note on the left-hand side, you will see the population is about 200,000. We have 20% older adults, predominantly an agricultural community. And when I say agriculture, I want you to understand that agriculture for us is what we call row crops and cattle. What are row crops? Sugar beets, carrots, tomatoes, lettuce, braca flower. And when you think of that, many of you are probably eating the sugar from the sugar beets that were grown here in Imperial County. I know you're eating some of the vegetables that were grown here in Imperial County. And of those ag communities, since we are one, about 40%, between 40 and 48% of our economy is based on agriculture. We do have some retails and we have services. Our challenges is our proximity to the border, need for healthcare and workers. We only have 2 full-size hospitals in the county. The youth move out after high school and they leave after community college and they do not return. So we have a major brain drain. I'm going to ignore that phone. If you don't mind it ringing, I don't mind it ringing. Our innovation is to partner, as I said, with foundations. We try to meet this with serving older adults in our community. And in that regard, we've been able to do that throughout this pandemic. The pandemic has put a major crunch in all of our ability to do things. Unfortunately, we had 2 members of our AAA who actually caught COVID. One passed away as a result of the COVID and the other recovered. So that put us at a very big disadvantage. Nonetheless, the members of the AAA stepped forward and began to do a lot of that work that our staff would normally do. And I have to commend our AAA and all of the members of the AAA for the work that they put forth. So if I could go to the next slide. So now we will go over to Kim. I want to say just before Kim speaks, I like the word hub and spokes because I think we're building a wheel within a wheel. And the only way for the wheel to roll is for all of us to be working together. Thank you.
Thank you, Commissioner Sanders, and thank you for all that you and the AAA and Imperial County have done to respond to COVID. So sorry for that tragic loss of leadership, and so grateful for the response to the pandemic that, of course, continues. There's no better way to start this conversation today about a vision for a network of hubs and spokes across California, and specifically across rural and remote frontier California than beginning in Imperial County. And you'll see on this call, we're going to travel around the state up to the foothills and all the way north almost to the Oregon border. But we'll stop here in Sacramento for a second. And I'll say that what this Hubs and Spokes initiative about, I'll speak just for a couple minutes about why we're here. We're here because the governor's master plan for aging at the recommendation of dozens and scores of stakeholders was that we focus on leadership in aging at every level in California, at the state level, at the local level, indeed even at the federal international partnership level. In particular, on this slide, you see three of the leadership initiatives that were called out. One is to revisit, take a fresh look at the Area Agencies on Aging Local Leadership Structure, Initiative 101. A related but independent initiative is to provide no wrong door service statewide in California, Initiative 98. And again, this is happening at state and local levels, create a governor's office position on aging, disability, and Alzheimer's. All over the state, at departments, at counties, in communities, people are looking at aging and disability. And why is that? This single picture attempts to capture the #1 piece of feedback we heard in our 18-month master plan for aging process. Too many consumers experience looking for aging and disability services for themselves or a loved one, like the picture on the left, which has lots of arrows and lots of doors and lots of referrals as a person seeks out maybe some home care or some meals or transportation or respite, and maybe sets one set of arrangements up and then things change and needs to make a change in the services and supports. And what the vision that we heard from both the Master Plan for Aging Long-Term Services and Support Subcommittee and the Governor's Alzheimer's Task Force chaired by Maria Shriver was the need for statewide single point of entry to the entire comprehensive web that a community has to offer. Public, private, local, city, county, regional, how can we make these services available? So that's the vision that we heard. The question is, how do we as leaders deliver on that? So this conversation, as Connie laid out, is about a potential framework that we could all adopt as a state and move towards together from our respective seats. So what is Hub and Spokes? It is a proposal for discussion. It is a concept of a statewide foundation and framework that every local community could adapt and adopt so that we're all delivering person-centered, equity-focused, data-driven services and outcomes to all Californians as we age. Well, that's a lot of words. What does that mean? Next and final slide before we turn to two leaders from rural California to talk about what they're doing and how they make it work. This is the concept of what a framework and foundation would look like. Let's start at the bottom. The notion is that for there to be effective aging leadership all across the state is a key partnership at the local level between three groups: the Area Agency on Aging, the County Adult Services, and community-based organizations in aging and disability, which includes groups like independent living centers, Meals on Wheels, family caregiver centers. I don't want to leave anybody out, but many, many nonprofit partners. That three-way partnership between Area Agency on Aging, County Adult Services, and CBOs is at the foundation of building this network. Okay, and then what are possibly 6 common features that we could all share as a state and local network? Going from left to right, there's that one door that we've all heard about and that you hear about a lot from our ADRC friends. One common brand, something like Covered California or First 5 with a web page and a phone number that we all know anywhere in the state. We can tell our friends and family. We can get help across the geography of California, as that front door. But then behind it is a comprehensive web, spokes, if you will, of all the services that community has to offer. And I'm really interested, particularly today, in hearing from the rural remote about these challenges of building out the spokes so that there are more services and supports in rural and remote California. But again, not just the AAA services, not just the county services, not just one nonprofit services, but person-centered, all the things that we need as we age or acquire or live with disability. The third feature we could all align around is quality. What are the outcomes we're searching for? How do we train ourselves to support that? Again, person-centered, data-driven, and equity-focused. How do we make sure that the magic of what happens in aging, way beyond referral to true person-centered interviewing, care coordination, and continuous support is happening once people walk through that door? The fourth piece is partnerships. Aging is everything. So even if we're doing all of that, there's three key partnerships that we heard about that we proposed to lift up. One is with health plans. This is an emerging area as Medicaid goes through CalAIM and California looks at Medicare integration. How can we make sure, help health plans pay for more of the home and community living supports that support health, prevent institutionalization? Two other key partnerships, unfortunately in California, emergency services. In an era of wildfire and climate change and power shutoffs, making sure we are prepared. And again, a very real, current, as we speak right now, issue in rural and remote California, how we keep everyone safe throughout the lifespan. And then thirdly, our historic partnership with over 100 federally recognized tribes in California serving our first elders in our nation. Last but not at all least are the two pieces of the backbone, technology and data. How can we are in the process right now with our AAA network, which is currently operating in 4 different computer systems, to migrate us all together over the next few years into one shared system so that we can be sharing our data, helping people across lines, and providing publicly transparent dashboards about how we're doing, among other things, and streamlining reporting so that we're all working together in one system. And then fiscal admin, how do we this is short and sweet, up the resources that we need to serve a growing and diversifying population and cut the administrative burden, whether it's contracts or subcontracts or monitoring that's not leading to meaningful results. We've got to up the support and reduce the admin. And that's something CDA has been working on and has more to do in kind of our CDA 2.0 effort internally. So that's the concept. Is that, and the question we brought to this group is that a framework that makes sense for your community, and particularly rural communities where you have, are you aligned with that? What would you need to get support in that? What do we have dead wrong? This is a 6-month listening to hear, and we are really excited to hear from our next 2 speakers and talk about their leadership in rural and remote California and where we go from here. Shannon.
All right, there we are. Hello. Hi, thanks, Kim. Good afternoon, everyone. My name is Shannon Gadd, and I'm the Director of Mariposa County Health and Human Services Agency. Just for your awareness, prior to this role, I was the Commissioner for the Department for Aging and Independent Living in Kentucky, so formerly Kim's counterpart in that state. And before that, I worked at a nonprofit that was a direct service provider contracted by an area agency on aging, or AAA. And in that role, I oversaw our senior center activities, in-home care, nutrition, friendly visitor, conservatorship, case management, and elder abuse victim services. So I hope that provides some more context for my comments today. So I wanted to start with just orienting everyone to Mariposa and Area 12. So our population in Mariposa is it's a little more than 18,000. And a good frame of reference is to look at population density. Our population density in Mariposa is 12.3 people per square mile. And compare that to San Francisco, which is 18,858 people per square mile. So hopefully that provides some context of our landscape here. So Mariposa is part of the Area 12 Agency on Aging, Joint Powers Authority with Amador, Alpine, Calaveras, and Tuolumne counties. At Mariposa HHSA, we are contracted with Area 12 to provide transportation, congregate meals, and home delivered meals. But as an HHSA, we also provide many other services specific to adult and aging, of course, APS, IHSS, housing, eligibility, veterans, public health, and behavioral health. So when we look at hubs and spokes and the master plan on aging, a few key challenges and opportunities for Mariposa come to mind. For the sake of time, I won't read every single one on these slides, but feel free to ask questions if you'd like some more detail. So starting out with our key challenges, I don't think there's a rural community anywhere who can say that they have sufficient housing. It's a serious concern here. It's a huge barrier to recruiting staff. For example, Mariposa was awarded a fellow from the CDC. So we were going to have a fellow in Mariposa from the CDC helping us with our public health transformation. Unfortunately, they declined because they couldn't find housing. So, and that is somebody obviously who had means and support. So when we think about affordable housing, it just doesn't exist here. And the housing that does exist, a significant portion is substandard. So living independently at home has some serious challenges for Mariposa. But also we have very few providers in general. For medical, we have one home health care and we have one critical access hospital. And most people receive their medical services in other counties. We have very few direct service providers. We have 3 community-based organizations that we work with primarily, and they are focused on children, families, and individuals experiencing homelessness. So no real focus here on aging and disabilities. That falls to HHSA. We only have one long-term care facility, and we don't really have any large-scale meal providers. In a significant portion of our county, we don't have meals at all provided for older adults through the Older Americans Act. There's just not the opportunity to do congregate or delivered meals in sections of our county, which I really don't like, but we're working on it. Geographic barriers, of course, internet access is a significant challenge here. Distance and frontier areas, it can take, up to 2 hours to get from a part of our county into town to receive services. And, likewise, to get services to people. So home delivered meals, how many miles are we driving per meal compared to other communities? Would be very interesting. And of course, transportation, huge barrier. Disasters, after disaster, after disaster. We had 15 proclaimed local emergencies in Mariposa from 2015 to 2020. And HHSA here, it provides mass care and shelter and transportation. And we also support our surrounding counties. So a lot of our work is focused on preparation for disasters and prevention, but of course, responding when those disasters occur. And we really don't have a position that's focused on disasters. It just falls on our existing staff. So that's a massive challenge. There are not enough hours in the day. Challenges also from state policies and regulations. As Kim mentioned, let's cut some red tape. That would be fun. Some of our challenges here in Mariposa are, again, related to housing. As an example, we return a significant portion of the money that were allocated for housing, not because there isn't a need, because there's a serious need, but because the funding restrictions and rules prevent us from being able to use it. Again, for example, the money that's coming from the state to develop housing, to end homelessness, has very little, almost a non-existent money for infrastructure. And our water delivery infrastructure, for example, has not really been developed since the 1950s. So another challenge with state regulation is a one-size-fits-all approach to oversight. And I'll provide an example with IHSS, has an 80% compliance rate for new applications within 90 days. Seems reasonable, and that's fine. But in Mariposa, we average about 4 applications per month. So if we have one single application that does not get processed within 90 days, for whatever reason that may be, of course, we try not to let that happen. But then we are required to come up with a plan to address our failure, as it's stated, and submit to participating in monthly calls and quarterly reports. So a lot of reporting that takes staff time away from being able to do the compliance that we're asked to do. So need to look at some flexibility in what the oversight of the state role is with rural areas and the resources that we have. So recruiting, of course, is extremely difficult to recruit licensed and degreed positions, partly because of the housing and commute and the opportunities. And with funding, our county has an extremely tight general fund, was not helped, of course, by the pandemic. And the funding that we're getting, from the state, and I think I can certainly speak for Kentucky too. The funding just doesn't account for geographic challenges. Just because you have fewer people does not mean you have fewer costs. So the interstate funding formula for the Older Americans Act, as well as other fundings that have formulas, is based heavily on your population size. And that simply just doesn't cut it for rural communities. So key opportunities, the size of our population, with 37% of Mariposans are 60 plus, 10% are veterans, which is actually double what this state has. The state of California is about 5 to 6% veterans. So we have a great population, so lots of opportunities to focus and lift them up. Other opportunities coming down with new funding streams. Hopefully we can build stronger partnerships, really integrate health and social services, find new providers, develop, workforce, and then, some of the state policies and regulations around the interest in broadband access and those flexibilities given by the Older Americans Act in the pandemic certainly present a lot of opportunities, and very excited about the discussions with hubs and spokes, the Master Plan on Aging, and CalAIM. Okay, finally, going to recommendations. Certainly the first recommendation, as I think is always the case, is to streamline funding and associated regulations. You can go to the next slide. There are way too many different funding streams coming down for the exact same thing, but with unnecessary and often conflicting rules. We're getting money and we're having to turn it back, not because our community doesn't need it, but because the rules are preventing us from spending it. And that needs a good solid look. Certainly with funding, considering geography and lack of alternate resources and funding decisions in Mariposa County, HHSA for aging and disabled individuals is it. That's it. There are no other opportunities or leaders in this space located in the county. Definitely encourage all of our state partners to visit rural communities in person. I have that perspective of living in different sized communities and working in different sized communities. Sometimes it's hard to conceptualize the challenges and the beauty of rural areas unless you can experience it firsthand. So our meal routes are always open to our state partners and to anybody else who wants to do that. I would definitely recommend, and I know Kim mentioned it a little bit here, but aligning hubs and spokes with CalAIM. So some more deliberate work, and there might be obviously that work going on behind the scenes, but the community integrated health network model that has been developed out of the Administration for Community Living is a very purposeful melding of those social determinants of health and the healthcare system. So the more we can do that would be great. And similarly, funding area agencies on aging to receive business acumen training. So again, diversifying that funding basket and developing opportunities for additional funding streams that aren't reliant on government dollars. And finally, prioritizing bringing services to people. In talking about hubs, of course, hubs mean something different to everyone. But when I think about that in Mariposa, I think a physical one-stop shop may not be the best solution. I mean, HHSA is kind of already in that space of being a one-stop shop, kind of. But I think about bringing services to people, because again, it can take a couple hours to get, to this building for services. So how do we utilize existing gathering spots to provide services? I mean, I even think, can we use gas stations? Can we use cafes? Can we use visitor centers? We have a surprising number of those here. But less on the physical location and more on how do we reach people where they already are. So those are my thoughts for now. And if anybody has questions, shoot away. And Terry is next. So I'm very excited to hear her comments as well. Thank you.
Okay. Thank you very much for the opportunity to present our PSA2 area agency in the far northern California. Next slide, please. PSA2 is located in far northern California. We are the third largest PSA geographically, covering 22,774 square miles. And as of 2019, our population was 275,319 in all 5 counties. So we are very rural and very much spread out into and cover many areas. So the area is comprised of high mountain ranges, winding valleys, numerous lakes, national forests, and massive wildlife wilderness areas, and 2 volcanoes. Let's not forget the volcanoes in our region. So our organization is formed under a joint powers agreement between Lassen, Modoc, Shasta, Siskiyou, and Trinity counties. The Area Agency on Aging is located, the administrative office is in Yreka in Siskiyou County. And we provide direct services, a combination of direct services and contracted services. Direct services are the Health Insurance Counseling and Advocacy Program, HICAP, and the Long-Term Care Ombudsman Program. They are also a direct service, and they are located in our most populated area in Shasta County in Redding, so that they have direct access to the most populated areas. Both programs have staff in the some of the remaining counties, and also in volunteers in those counties. So we're out into the communities and into these other regions, not just focused in Shasta County. Nutrition providers, that is a contracted and direct service. We have 9 contracted service providers, and some of those 9 contracts throughout the 5 counties, we have at least 1 nutrition program in each county. Some of those also provide satellite nutrition opportunities where the meals are prepared in the main location and taken to the satellite location and in a more remote area. That works well to try to get the meals out to as many areas in that county as possible. We have, there is one area that we are unable to find a contracted service provider. So we're newly developing a nutrition program in one of those areas that will be a direct service of the Area Agency on Aging in collaboration with a nearby service provider. So we're, and a community group to help us with that transition. We also offer transportation that's contracted service in all 5 counties with the nutrition service providers in the region. Mostly that transportation is focused on the local area of the contracted service provider, so there is limitation in transportation there. The Family Caregiver Support Program, the legal services, And evidence-based health promotion programs are all contracted services, and all 5 do serve the 5-county region. So they, whether it is remotely or virtually, they were working to provide the service to the seniors in all 5 of the counties that they serve, that we serve. Community education is provided and planned by the Area Agency on Aging. We work with many of our community partners to bring community education ranging from elder abuse awareness, Alzheimer's in collaboration with the Alzheimer's Association, and many other fall prevention, many other services we bring to the communities with our partners. And also elder abuse prevention and awareness is conducted directly from the Area Agency on Aging, and we do work in all 5 counties to raise awareness on elder abuse, and by displaying banners and flags with a number of elder abuse cases that were reported the prior year, so that we can have a visual so others understand the seriousness of elder abuse and want to raise awareness in the community. Also, our program staff we have staff in various programs throughout the 5 counties, and we are able to partner with many organizations. Our advisory council is made up of and includes representation from Adult Protective Services and also Health and Human Services, and that's a great partnership. Our contracted service providers are great partners in our efforts to bring all this education to the community. And also we are very active with community aging advocacy groups. I mentioned the Alzheimer's Association to bring education on Alzheimer's awareness, and community-based organizations we work well with to bring, again, share as much information as possible on the services and programs available through the Area Agency on Aging. And related to elder abuse awareness activity, we work with local district attorneys and with law enforcement to help bring information and awareness to our 5-county region on elder abuse. Next slide. Okay, our key challenges. Many were mentioned in the previous presentation. We basically mirror the challenges in most rural areas, and that the lack of resources and sufficient program funding to support unmet needs for a growing older adult population. Housing definitely is not only affordable housing, but in our region where we've suffered many wildfires in our area, many are being displaced because of the local wildfires, and that adds to the intensity of the need for housing in our areas. Caregiving is also another unmet need. There's a growing gap between those that qualify for in-home supportive services and those that can afford private pay. Therefore, many go without care in the home, with in-home care. And many, to be quite honest, some of our counties are struggling to even offer in-home supportive services. They have a challenge in filling those positions, and it makes it an even greater need in those areas. Transportation, as I mentioned, is offered, but it is limited in the immediate vicinity of a contracted service provider. Transportation to medical appointments have been a great need for a very long time. And it's limited to non-existent in some areas when an individual needs specialized medical services and they're unable to go down to outside of the county, mostly Shasta County, and for treatments such as dialysis treatments. And they're required to travel long distances to get to this service. And in some of our bordering counties, they also go into Oregon and sometimes even to Nevada. They need to get to these services there, and it can be challenging. Medicare Advantage plans do not exist in most of our rural counties. There's a challenge there with being able to provide that service. Therefore, it's basically non-existent other than in Shasta County. It is offered in Shasta, but the other outer counties, it's very difficult to have these services that and Medicare just doesn't go as far in some of these counties. Long-term care facilities are, and that's a challenge. They are far too few. Aging communities, which makes placement very difficult because it's difficult to impossible to find a facility, and not only find the facility, but also have the room and the capacity to serve everyone. It's just not here, and it's non-existent, and we need to focus on that area. Increased service costs in rural areas. As it was mentioned earlier, we have to travel much farther to get that home delivered meal to individuals. Minimum wage increase also increasing for the staff, and so all these costs are just escalating, and it's not allowing service providers to reach as many individuals. And so we are very grateful that that is changing very soon, and has started to change with Department of Aging's additional funding. And then isolation is also a challenge for us. We have, as I mentioned, a vast region, great distance to access services. It's difficult to impossible when you add to that bad weather conditions. Many of these higher elevations experience road closures and hazardous road conditions due to snow and ice. And with that has to be considered in all the work that and travel that we do, not to mention the natural disasters and wildfires that would cause road closures and inaccessibility. If your rural area experiences this as well, we also have to consider road construction that happens, and that can hold up quite a bit of travel. And then also isolation in itself. This causes isolation, and which then leads to loneliness and can lead to depression for older adults who are in these isolated areas and remote areas, and they do not always have the ability to interact with others, and many of them depend on that home delivered meals driver for just to make a human connection, and it's really important to make sure those services are always available. Next slide. So the key advice as we reflect on all of our challenges related to serving in the rural community is to research the unique needs of area agencies on aging to better understand priorities of rural AAAs and the limited resources that we're working with. We also would like the state to acknowledge rural AAAs, the disparities that we experience as they look at equity and aging in the initiatives of the Master Plan for Aging. We would like the state to consider adding rural area agencies on aging as due to the disparities we experience with the lack of services. Also include area agencies in policy-making decisions. It affects us directly, and we are all very different. We are all unique, and it's important to consider what resources we have and do not have to be able to meet any new policies. So it's important for that communication to remain, to include the area agencies directly. We hope to secure sufficient funding for rural area agencies to expand limited or non-existent services that I've explained. We are very limited. Of course, we know the dollar follows the population, and because we have lower population doesn't mean that we don't need the funding to serve our rural communities. We'd like to see an increase in funding to support the information and assistance programs, which supplement the existing federal support. The information and assistance programs are the entryway to reaching all of these services. And if we had more information and assistance funding, we could do more and reach more people to inform them of the services that are available in the community. And we'd also like to consider the restoration of funding for the Alzheimer's Daycare Resource Centers and linkages programs. Back in 2008, 2009, those programs were devastated by the loss of state funding through the Older Californians Act, and they were much needed programs, especially the Alzheimer's Daycare Resource Center or daycare centers. They were very helpful for those who were caring for a loved one with Alzheimer's disease. We'd like to see a streamlined access to, as was mentioned earlier, streamlined access to program funding and both program and administrative funding for the area agencies. We'd like to see that the state provide tailored support for older adult needs in area agency regions ravaged by natural disasters, wildfires, public safety power shutoffs, drought, excessive heat, all of which we experience in our far northern region. Advocacy for expansion of broadband and cell service in rural regions. Yes, cell service. We have many areas that do not even have cell service, and that is very challenging. Of course, the internet isn't available in all areas, which makes it very difficult for older adults to receive information on services, and even through the pandemic, it's been challenging to get that information out. So support there would be very much appreciated. And provide clear and consistent guidance to the area agencies on aging with program policies and regulations. Consistency there is really important to make sure we're all on the same page. Implement open planning and communication practices with the area agencies on aging. Have us at the table. We are very different. We're very unique, and even amongst the rural area agencies, we are all very different. So open communication is very important, so that we can share our concerns and will this work, and if not, why, and address those needs. And then, as mentioned earlier, also expand aging and disability resource connection, resources to include a collaboration between area agencies and disability resource centers, so that we can serve the entire population of those in need of aging and disability services. And to also consider, as we move forward with the master plan for aging, just support existing service structures in rural area agencies, which have, and my partners that are in rural communities, which have had to, that's the way that we have had to focus, is to develop a hubs and spokes model that works, because we cover such vast areas. So support existing service structures of rural area agencies, which currently are working in that model. So thank you very much for the opportunity to share life in PSA2 and in the PSA2 region. And are there any questions? Thank you.
Perfect. Well, thank you so much, Terry and Shannon. I appreciate you sharing your unique perspectives from that rural AAA. And I do want to turn to Q&A. So if you have questions or you have comments, please feel free to either search on your Zoom toolbar. There's two options there. You can use the raise hand feature. That'll add you to the queue. We can open your line to hear from you directly, or you can pop your question or comment into the Q&A chat box. Looks like we have somebody who's already done that. And let me introduce or pass it back to Connie, who along with her colleague Carol, will facilitate the discussion.
Yeah, thanks, Maria. Oops. Okay, can we just advance to the next slide? So kind of to help us with the discussion, we kind of have some questions here to help guide the discussion and you know, the comments and questions. But some of the things we'd like to know is, how can the state help communities establish a hubs and spokes network for aging and disability in your community? What are some of the opportunities and challenges? I know we heard, you know, from two local perspectives, but we'd like to hear from those as well that are participating that would like to share. And also, do you have any advice or comments to share as well? Any recommendations or any feedback? So just some things to keep in mind for, you know, as we're going through the discussion. So I think there's a few questions that are coming in right now. First one, let's see. So It says, so during Shannon's presentation, she made the argument that the current funding is based on population and the state should consider geography. Areas with higher population have a similar challenge with having a higher cost of doing business as the wages are higher due to housing and living costs. They could make the argument that urban areas should receive adjustments in funding as there are more people to serve and the cost of service is higher. How should the state balance two valid arguments, and what are the current thoughts about changing the current funding formula? Any thoughts on that from Shannon or Kim or Terry?
I'm going to let Shannon start because she took a good look at it in Kentucky. Shannon, you want to share?
I can share, and unfortunately, I don't have any magic answers. I did spend a lot of time in my last role in Kentucky playing with the intrastate funding formula because I wanted to get more dollars to our rural communities. And quite frankly, I couldn't do it. I couldn't do it under the Older Americans Act parameters. So unless there's a federal change, I don't see the funding formula changing in that regard. However, what we did do is we started having discussions about business acumen and how do we get additional dollars into the state to focus on rural areas, but also our urban areas. I wouldn't ever venture to say that our urban areas have sufficient funding either. I think aging in general is underfunded, and certainly services for people with disabilities. It's all underfunded. But the funding formula is based on population. I don't see that changing. I think the balance, as I said, is to get new funding streams in the door. And with CalAIM, with a federal focus on social determinants of health, the way to do that is to partner up with health plans and do some billing. So hopefully with the master plan on aging and the changes in CalAIM, that will develop some new funding sources for sustainability. So that's my 2 cents on that.
And I'll just add a sentence. I mean, Older Americans Act is up for reauthorization. So if this was a place that California wanted to weigh in on with if we had some consensus recommendations from the network, we could all work through our various channels to try to influence the federal level. And then to remind people that there's increasing, particularly this year, general fund, where there is more flexibility in the formula that we use to allocate it. So again, if there was consensus about a better way to allocate the money within the pie, we would be very interested in a work group on that to do that if we thought there was a way through those various challenges and cost pressures. But take Shannon's point that growing the pie is the win-win solution.
Next, so here's a question that we get at every town hall. What is that the ADRC initiative does not provide that you're looking to hubs and spokes framework for? As I hear it, hubs and spokes feel like it is the ADRC. So maybe a little more clarification on ADRC versus hubs and spokes and what's the relationship there?
Sure. The basic connection is that, well, they are similar in their concept of hubs and spokes. We want to make sure that to achieve our goal of a statewide ADRC, that our AAA foundation is poised for success, has the business acumen, has the resources, has the structural partnerships that will make that possible. So that's why we're so focused on AAA, CBO, including Independent Living Center, and county partnership, because we know that any successful ADRC will have that behind it. We've heard that from Marin, we've heard that from Ventura, we've heard that from San Francisco, and so we wanted to, keep test driving that. So some of the issues that specifically might come out of this, as you can see on our resource page, have to do with everything from the processes that we do at CDA to do performance indicators and how we monitor. So we're monitoring more for value and performance. We've heard suggestions about core AAA services, of which ADRC could well be one of them, but there would of course be others if there was a core services discussion. Discussions about the AAA map, the 33 PSAs, and whether that's the right number or kind of Goldilocks, too many, too few. There's lots of opinions on that. So some of those questions are not really core ADRC questions, but they are core AAA questions. And AAA, as a core partner of ADRC, needs to answer those questions so that we can be successful leaders and partners with ADRCs. So they're definitely interdependent, but I do think there are some AAA issues that stand out as needing to be resolved on their own. And that's part of what the Hubs and Spokes Initiative is about.
Oh, you want to take the next question?
Sure. It is well documented that service costs are greater in rural regions, yet the population-based funding formula persists. What type of efforts can be done to get a differential increase for rural regions?
Is that a question for anyone?
Yes, feel free.
I would like to try and answer that. As I listen to my counterparts in rural areas, there's quite a bit of difference between us, between the northern rural communities and the very southern tip rural communities. I heard her talk about wildfires and drought. Imperial County has wildfires, don't have the wildfires, we have the drought and the heat. At any point in time, our heat can reach between 118 to 120 during the summer. And of course, we're having that problem. And the way that we have chose to expand capacity was to look beyond just what the county and the city and the federal government and the state could do. We tried to partner with foundations and faith-based communities, food banks, and others that could provide that level of service, at least to get meals to individuals. We even partnered with certain doctors who were willing to accept a small number of patients that may need health care. Now, they did this for gratis, but they only had a window of opportunity for, say, 10. But at least that was a foot in the door. Now, when I listen to some of the things happening up in Marin and Modoc, I'm very familiar with that area. And I'm thinking your uniqueness is a little bit different than Imperial County's. While you're above sea level, we are below sea level. While you have 7 different counties, we only have 7 cities within one county. While you have other cities around you, we have the Mexican border. While you have other communities, we have the Arizona border. So those are some different challenges. But we do have 2 hospitals here. One is a public hospital, the other is regional. And they are willing to accept certain patients, but keep in mind, there's only a few beds available to those patients that are in need and have limited health care. In-home health care is a major, quote unquote, major issue. I can say that multiple times and will not reach the number that it is. But nonetheless, families are put into families are having to, I want to use the word struggle with how they go about providing that. So that becomes on the wives, the daughters, and the sisters to try to help these family members. Nevertheless, we do and we have worked with the County of Imperial, and we've asked for some funds, and we have been able to secure funds through the county to help with in-home health care. But it is not sufficient. So how do we go about making a one-size-fit-all? I'm beginning to wonder if one size does fit all. I'm beginning to think it doesn't. One size does not fit all. So maybe we need to look at what size do we want this to be and how can we expand it? I think I mentioned that earlier. It needs to be expanded by using the foundations and other faith-based and other different groups that will come in and help fund some of these activities that we're trying to achieve.
Great, thank you for that question and that answer. Let's go to the participant. It looks like there's a hand raised. Can we unmute Tanya Harmony Rodino? like, are you unmuted? Tanya, maybe you need to unmute your end. Looks like we're
Tanya also has a question in the Q&A, so maybe you can read that out loud while we're waiting for Tanya to try to unmute herself. And we'll hopefully
Tanya, I can read it while you're waiting. Just want to say I appreciate the perspectives of both Shannon and Terry provided, and that as a small service organization that serves very rural San Benito County seniors, we are concerned about the proposed redistricting that hubs and spokes may create. We are happy with the mechanism of our seniors council serving both San Benito and Santa Cruz County and would not want to see it change.
still having some difficulties.
That's a statement. I don't hear a question, Madam Chair.
Yeah, there's 12 other comments, so let's keep going.
Oh, okay.
Another question here. It's for Commissioner Sanders. Imperial County is the smallest AAA in California. Wouldn't it be more beneficial to try to merge with the San Diego AAA?
You know what? I'm so glad that question was raised because we have certainly tried to do that. And it appears as though, let me put it this way, the effort is still being made. I like to use that phrase. We're still making the effort to try and partner with them. But sometimes the more urbanized communities such as San Diego and the rural communities do not necessarily see that there is a common mix. But the effort is being put forth. We're trying.
That's great to hear, Sedelia, because that's certainly what this Hubs and Spoke initiative is about, is those conversations. What's working well, as we just heard from the provider in San Benito, what could be looked at again, as we just heard from a provider in Sacramento. I'm hesitating to share this information because it's a rural call, but our most urban community, LA County and LA City, are two AAAs, and they are in talks to consolidate. And so I think that's what this process is all about, is coming out of COVID, coming out of the master plan, and with this unprecedented resource opportunity to build back better, having those conversations. So that's great to hear, Sedelia, that San Diego and Imperial continue that dialogue.
Our AAA executive director, she's putting forth a full court press in that regard. She's really working hard. And we are, as agency members, we are supporting her in that effort.
So I'll read a statement from Kelly. I would like to recommend state funding to assist counties in developing their local MPA playbooks, which would identify specific challenges for each county, especially our rural counties. Developing a local playbook is a time-consuming project. Thank you for that comment, Kelly.
And I'll just add that something we're thinking about and would welcome input on is, of course, there is an annual planning process in the AAA world with state local area plans that are updated. And so that is one of the questions is there opportunities to integrate local master planning and local area plans without adding more bureaucracy and red tape, which we've just talked about today. So welcome input on that question so that we're not having multiple plans, but also aren't overcomplicating things.
The question to the presenters. Rural programs are very under-resourced, but also incredibly innovative and effective. Can we seek out a statewide innovative grant to create a rural aging assistance program, sharing best practices and strategizing how to meet challenges? Any thoughts on that?
I think that's really cool. I would suggest maybe it be a workforce or a work group or a task force under C4A would be my suggestion. And maybe there is one and I just don't know because I'm not a AAA. But I think that would be an awesome opportunity to share info. Yeah, I think it's great.
And Shannon, if you could stay on, here's a question I think you wanted to answer. For any of the speakers representing rural counties, what has worked or not worked to increase recruitment and retention of aging services workforce? How can workforce deficits be addressed in Hubs and Spokes initiative?
Okay, so I'm going to share an idea I had previously, and I was going to talk to Kim about this offline. So it might be crazy, but I've long thought that, rural communities, typically have higher unemployment and fewer resources, and often a larger population that's aging or has disabilities. So my thought is developing the workforce within the community itself to care for and provide assistance to the community. Does that make sense? So providing state funding, federal funding, whatever, but workforce development dollars, the WIOA dollars, don't ask me what that stands for. It's to develop a direct service workforce in the community to care for their own. I mean, rural communities typically are very proud of their strength and how they come together. So to be able to use dollars to develop its own workforce, to support its own community, I think would be phenomenal. But that's my idea. I haven't had a chance to put it into practice yet, but who knows? So, and anybody can take it and run with it.
I'd like to try to run a little further if you don't mind. I'm going to use this as a relay race. You started the ball moving and I'm going to take the baton and move forward. Yes, Imperial County has started with our Board of Supervisors to try and get what we call a scholarship fund available to go to the community college to help educate and inform and make sure individuals are prepared for these jobs so that we can hire from within. And we try our best to get that done. The board has been amenable to that idea, but thus far does not seem to have any takers in the numbers that we were hopeful. But that does not mean it won't work. I agree with the concept.
And this is Terry with PSA2. I would just like to say that we greatly appreciate the increase in administrative funding because we receive probably close to the lowest amount of funding because of our population in our area across the state with program dollars. And we have experienced times where it's been very difficult to retain staff because we had challenges offering a livable wage. So just thank you to the state for the additional administrative dollars that really supports and allows us to offer the ability for folks to join us in our effort to work toward older adult issues and stay with the area agency a little longer than we've seen in the past. So it has been a struggle for us.
If I may, to our facilitators, I want to make sure that given the conversation we just had about the Imperial AAA, that we recognize the leader of the Imperial AAA, who's both in the chat and in the questions. Sarah, can we open up her line?
Hi, can you guys hear me?
Yeah, we can. There we go. Thanks, Sarah.
Hi, thank you for seeing my hand raised and my little note in the chat. First, I want to thank Sedalia for speaking so eloquently with our AAA and the work that we have done for the COVID response. And she's always been a huge advocate for us. So we are always excited when I see Sedalia speaking. But I kind of wanted to add on to Mr. Taft's question if it would be beneficial for us to merge with San Diego County. San Diego County has an amazing independent services unit. And I wish someday we could mimic and follow their direction. However, the distance between the two counties and the different type of populations we serve would really hold us back from ever truly merging. We are in in the beginning stages of becoming an emerging ADRC. And one of our emerging partners has an office in San Diego. So I think that's what Ms. Sanders was referring to when she said we are working on it. But I don't think it would be beneficial, as Ms. Sanders said. Our population in this rural area is just so much different than in the urban area and what San Diego sees. So it is kind of interesting, and the reason I've been attending all of these town halls is trying to kind of grasp how other counties are considering the merging, or how they are deciding on who should merge and who should not. So I just wanted to kind of add that on to Mr. Taft's question about Imperial County. Thank you.
And I wanted to just, I can't seem to find it, but one of the commenters had a question about the business acumen conversation and what the research is and the data is on that. I'll point you to the 2 webinars we just had on leadership and aging from USC 2 weeks ago, and UC Berkeley, let me get that right, last week, which were sharing their research. I probably did a poor job of verbalizing it. And of course, our federal partners have had a Business Acumen Institute for AAAs for years, that we have offered a planning grant to C4A to think about how we could help, how they could help strengthen the network for health plan partnerships. So all that resources are on our webpage, and of course, C4A is a resource on that as well. But that's where that lingo comes from. Other new questions or comments?
Here's a question, Kim. What is the process that will be used to determine whether or not a AAA will be geographically reconfigured, and or how it will be reconfigured?
Great question. One of the things that we're learning in this phase of listening and town halls and webinars and meetings is that we need to do a lot of more information sharing about how it currently works, So we will be reporting back in December what the feedback and findings are from this process. And as part of that, we will be sharing what are the current processes for how changes in the map can happen, which at this point we can, as LA County and LA City have contacted us and let us know that they are contemplating that. Any community who's interested in exploring that can reach out and contemplate that. And that's something that the department and the local leaders involved would work through in partnership with ACL as a potential change in the map, which of course does trigger many other changes. So it would be a collaborative, transparent, intentional process. So that is the case right now, and that remains the case ongoing, that those changes can be done. The other question we often get is changing the designated AAA within an area. So not changing the area, but changing the designated AAA. And currently that happens when the AAA itself relinquishes the role, or if there are significant performance issues and the department takes action. What there is currently not, and this is something that has been in discussion, is an opportunity for county leadership to revisit decisions, to reconsider how they want to organize. And so that is something that has been discussion, is how do we make sure our county board of SUPs continue to have an ongoing role in the structure of aging services locally in partnership with the state. So we'll be doing some more kind of information sharing about current possibilities. We have the kind of report out given the number of questions about how this all works and some of the ideas we've heard about enhancing and building on that foundation going forward.
Let's see, we had, oops, where'd the question go? Here we go. What is the future for the long-term care ombudsman? Smaller programs cannot find volunteers and have to hire staff, which has proven to be more beneficial as mandates are being met for the first time ever in the program. However, the lack of benefits, as well as providing a wage that is equitable to the amount of work that an ombudsman has to do, shows the inequity in funding of the programs. Is there any discussion regarding revamping the long-term care ombudsman program, as well as bringing more money into the program? Terry, you wanted to take this one?
I was actually hoping that Kim might be able to address that question.
Sure, Carrie, but Carrie, you jump in and correct me. So thank you. This is part of why the AAA question is in focus, is because of the unique relationship with both ombudsperson and HICAP in a couple senses. So first, let me say the ombuds program is independent on voice, and we do have an acting right now and are hoping to appoint an ombuds. So that person, the new ombuds' direction will be essential in this. But this question of operationally, are there opportunities to regionalize services like ombuds or HICAP or legal services or family caregiver centers that don't happen to be in every single community in every single county, is one that we've heard asked a lot, and we are very much seeking input on what that would look like. And it does already happen a little bit in terms of some AAA sharing the same ombuds, but that doesn't reduce the reporting or the contracting. So we're not sure that's the most elegant and effective solution. So we are meeting with the HICAP Association to hear more of their thoughts, and we're meeting with the Ombuds Association to hear more of their thoughts about it and welcome input on that. Again, we think there could be opportunities to retain that local direction and control and partnership and integration, but perhaps recognize the challenges, and that moving to a more regional approach could get the best of both worlds. But how to do that is really a tricky one. And so we need more input from AAAs, ombuds, HICAP, and all of you about what, or some folks who want to innovate. If there's a region who wants to try something, we're all ears and we can do it. Let us know.
Here's a question from Debbie. Could CDA encourage and fund the formation of villages, the village movement model, as support systems for older adults in rural areas? Some counties actually have a department staff member to help start these local networks, since they effectively deliver lots of services with mostly volunteers.
I think that comes into the larger question of does the network want to come together around core services? That would be kind of, everybody would agree to prioritize those or do those. And what would that list be? Our colleagues in New York have 20 core services that all the network provides, with, of course, options to do optional. So I think that's one of the questions that has been suggested for kind of a work group project, is what would core services be like, and would village movement or other models like that be in that mix? Or again, innovation grants could be given, technical assistance groups could be created. There's opportunities to explore. If I may, I want to make sure we also recognize, I think Maggie Kraft, one of our AAA leaders from the North Coast, has some questions. Have we spoken to those?
Not yet, Kim. I'm happy to read her question.
Great.
Regarding Build Back Better, do you have good data right now regarding overall AAA performance statewide to warrant making changes versus providing technical assistance? It seems ideas to move AAAs into county only impacts a small number of nonprofit or JPA AAAs who aren't in counties. Shouldn't we then have conversation between the nonprofits and CDA to address CDA concerns rather than suggesting such a sweeping change? Also, why do some attendees have the opportunity to send comments anonymously and some don't?
I will not answer the last question because that's a mystery to me too. I don't know how that works in Zoom. Maggie, to your general point, absolutely. CDA is committed to doing both, to doing to doing those technical assistance and support. As you know, we're moving to create the CDA AAA operations work group to have an ongoing forum to improve our operations. And provide more also subject matter technical assistance on everything from digital divide to meals, the project that Victoria Jump is helping us with right now. So absolutely, technical assistance and partnership. We're also committed to performance data, and we dipped our toes in the water with that, with our data dashboard during COVID, where you can see how many meals, AAAs, and how many INA calls. And you can do a little bit of comparison over time, comparison across geography, but it's not perfect. It's very much a beginning innovation. And we are committed to kind of move forward in developing with the network and with consumers and stakeholders, what are those outcomes and accountability we all want to be hitting? We've heard other counties talk about that's very similar to what's happened in the children's world. How do we do that in the adults world? in a reasonable way. And yes, also on the table are changes in structure where warranted. I saw your comment that LA is anomaly. I think every region in the state is unique. And so where that's appropriate, it's in the mix, and where it's not, it's not. And so, this won't be one big change. This is everyone coming together to see where are the opportunities, where are the challenges, and how do we all move forward better aligned and better strengthened. And that will mean different things in different parts of the state.
Great, let's move over to the phone lines right now. If we could, let's go to Corinne first. Corinne, if you'd like. There you go.
Yeah, I unmuted. Hi there. I was interested in the conversation around training from within. In particular, it's an exciting concept because I'm here in Lake and Mendocino County, MSSP, and one of the issues that seems to continue to present itself by entities is that rural, remote, the thought that rural and remote entities should pay less. For some reason, it seems to that people think that it's always a low income environment because it's rural. The people that we're hiring or able to hire here should work for less. And it's really not true. I mean, there's things like propane that are extremely expensive when you're in a rural area. There's electricity, PG&E is higher than all get out. Gasoline cost, rentals are few and far between, and therefore they're high. There's premier, rates and stuff that are attached to that. Student loans for anyone who went to school and came back and maybe wanted to come back to a rural area that they had once resided in. It's still key to things like, however much money you borrowed and whatever. So I'm just wondering if there may need to come a time, and it's not very far off, when there's going to need to be outside guidance to see this and figure out how to bring this all together. Because if you have a social worker and you want to pay them a decent living wage, even though you may be in a rural area, you can't offer them $19 an hour when Costco's paying $19 an hour and when In-N-Out Burger's paying $23. You have to recognize the professional skills and the training and the schooling. So I'm throwing that out because as we unfold the master plan on aging, we're going to need to remember that it doesn't matter that you're in a town of 16,000. It could still be expensive to live. It could still be, you could still have debts and things that you need to manage. And we don't want to run the greatest people away to Los Angeles or SAC or some of these other places. We need to keep them here in our small rural areas to provide excellent quality service to our folks that need it here as well. Thank you.
It's a slightly different point, but you're reminding me of the late Steve Wallace's work on the Elder Economic Sufficiency Index when he presented it and showed the cost of living for older adults in Los Angeles County is the same as in Humboldt County. And in Los Angeles County, the cost pressure was the housing in his work, and in Humboldt County, it was the healthcare costs. There were less subsidies there. And so I think the point is kind of getting that true picture of costs of living and accounting for the different geographies as best we can is something both on the elder self-sufficiency side and also on the critical workforce.
Absolutely. Thank you.
Thank you.
Move to Vicki. Vicki Clark has her hand raised. Vicki, if you could unmute yourself. While we're waiting for Vicki to unmute the other.
Can you hear me now?
Yep.
Oh, okay, had to follow the instructions. Hi, my name is Vicki Clark. I'm for the Sierra County Health and Human Services Director. And I would just like to thank Shannon especially. I could have dittoed right alongside so much of what you said for the challenges and the opportunities for your small county. I don't know what my person per square mile is, but I can tell you that there's only 3,000 people in the entire county. And I get really fascinated when we were talking about this workforce, that we're needing, because, we virtually have, 2 in the entire county, small little community-based organizations. There really is no one to contract for. We've talked about getting the state to help support building the infrastructure of some of our community-based organizations. But that aside, I love the idea of local workforce. I like thinking about that's not going to come through a community-based organization necessarily. It's going to need some assistance and maybe setting up some kind of backbone, kind of an organization that can, help with training and insurance, because you're going to have a bunch of individuals, many of which that are probably volunteers now, or doing caregiving already. And I would love to see, maybe we have a lot of volunteers at our senior center, and using some of our seniors to help seniors. I did a lot of research in graduate school and found that all our fancy services and things are not the most important thing to our elders, that socialization and just that human contact is probably the most important resource, and doesn't have to cost a lot to help people to connect up and do that. But I also think that we're not tapping the youth, and we have a lot of youth in our communities through the high school and community civic engagement. And if we could engage them, I know that on the public health side, we're talking to the state about getting in there and working with some of our higher institutions of education to start working at that level to promote people going into geriatrics and some of those professional technical positions well. So anyhow, I'm just babbling away here. I think there's lots of opportunity. I really want to see us working together. I think that there's maybe some kind of a hybrid kind of things to consider, that some things make really good sense to do regionally, and some things really make sense to be very individualized to my county with my locals and the way we want to do things. And I'll stop there. Thank you.
I just want to jump in and comment on Vicky's questions or comments. So first of all, the population density for Sierra is 3 people per square mile. I did the math the other day. Anyway, one thing that you mentioned about workforce development and how like the state or county can provide some resources for that. And one thing we did in Kentucky is we used the WIOA dollars, which I was going to Google, but workforce development something, I don't know.
Yeah.
Yeah. We use the WIOA dollars to establish an internship training type program for case management. We saw a lot of turnover in the case management space, both on the aging and the disability side. So we provided paid internships for Bachelor of Social Work students. And with the hope of creating that, that pipeline, that workforce pipeline, encouraging, the social workers to work in the aging and disability space and get paid. I was a little jealous because I didn't get a paid internship, but c'est la vie. And then hopefully get them into the workforce. So there are the opportunities for funding that's available to establish those pipelines. I don't know the workforce space here in California, but that's something that we did that maybe we could do something like that here.
And I know we're getting close on time, but I just want to put a plug that not to say that it is enough, but there is more state and federal funding in these spaces than there has been in most of our memory. At the state level, there is workforce funding that pending final sign off from CMS. CDA will be leading $150 million direct care workforce investment. And so some rural and remote innovation is some very exciting brainstorming here. I'd love to hear more from C4A and other leaders in this space about what that could look like, a rural remote. And I see the question on Title 3B. In some ways, this is a rough equivalent. The general funded 106 million California Older Adults Recovery and Resiliency, CalOR as we sometimes call it, in-house, does have line item funding for many, not all, but many supportive services, family caregiving, legal services, digital divide, elder justice, one time over 3 years, but potentially a springboard for that broader conversation about investments in supportive services that support healthy home and community living. So great point. Let me hand it back to our moderators and hosts because it is 3:30 on the dot. Are there other burning issues? Like I want to make sure we haven't left anything hanging, but I know there'll be more to come too.
Yeah, we know we're close to time. Actually, we're at time. If we could go to the last slide. Oh, right there. So all of the stuff that we've discussed today, you can find it on our Hubs and Spokes webpage. There's a link directly from the CDA webpage. We want to thank everybody for participating. Also, after when this meeting closes in your browser, there will be a direct link to the Hubs and Spokes survey as well. It's available online. Commissioner Sedalia, do you have any last words as we close that you'd like to address? No? Okay. Well, we will wrap this up. The recording will be available online in the next couple days. Thank you for participating, and sorry we couldn't get to everybody's questions, but we will also post all of those as well on the webpage. So thank you for attending today.